Exactly 11 minutes past the top of the hour. Time for our last conversation this Monday morning. And currently, the state is rolling out a pilot program of what is dubbed the Universal Children Benefit Program. So what kind of program is this? How sustainable is it? For how long will it be rolled out? That is what we are set to interrogate right now with my guest. To my immediate right, that is John Gachagi, who is the Director of Social Assistance. Right next to him is Peter Ombasa, Assistant Director, Children Service. Karibu sana, gentlemen.
Thank you.
All right, before we get to the UCB and what it's all about, what it's set to do, let's start from the brand, the mother program, Inua Jamii. Talk to us about that.
Thank you for inviting me in the studio. Inua Jamii is a brand name for the consolidated cash transfer programs in Kenya, whereby we have got 3 cash transfers program. One is called the cash transfer for orphans and vulnerable children, which was started in 2004 as a pilot in 3 districts. That was in Kware, Nairobi, that was Kware, Nyando, and Busia. And it was started as a pilot to check on how the orphans and vulnerable children can be catered for. It's called orphans and vulnerable children because it caters for children who are either double orphans, have lost 2 parents, single orphan or left 1 parent, or vulnerable children. They could be having 2 children, both parents, but they are living in a very, very vulnerable conditions. Like maybe the parents, they are sick, they have HIV/AIDS, maybe they are disabled on other things. So since 2004, the program has expanded, and currently we have got 352,000 households who are enrolled in the program, and they get a cash transfer stipend of 2,000 per month, which is paid after every 2 months. That is 4,000. The second program is called Older Persons Cash Transfer Program, which target the senior citizens who are poor and vulnerable. The program started in 2007 as a pilot. It started in Thika, also Nyando, and also in Busia. So the programs also target those households which are very, very, very poor. And in 2017, the program was expanded to become a universal, targeting all the senior citizens who are 70 years and above. They also get 2,000 per month, 4,000 after every 2 months. The programs covers all the 47 counties, all the 290 constituencies. Currently, we have got 833,000 households who are enrolled in the program. The third program is called Persons with Severe Disability. The reason why it's called Persons with Severe Disability because it targets persons who are severely disabled. They require 24-hour care and support. It started in 2011 as a pilot. Currently, we have 47,000 households who are benefiting from that program, and it's also in all the 47 counties. So the total amount of the total beneficiaries for the 3 programs is 1,233,000 households. And our annual budget for the 3 programs is 29.6 billion Kenya shillings. And it is important to point out here is that all the money which is paid for the Inua Jamii cash transfer is 100% tax financed. We don't spend even a coin from the development partners to pay our cash transfer programs. Thank you.
So all that is financed within the country?
Yes.
And over time, it has expanded to various counties to cater for actually even all the 47 counties?
It's true that after the initial pilot for the 3 programs, it expanded to all the 290 constituencies, all the 47 counties. So they are national programs. They cover every section of the country. When it comes now maybe to the payment, the money is paid to the beneficiaries, or where the beneficiaries cannot be able to receive money on their own, like the orphans and children, persons with severe disability, the money is collected by their caregivers. The money is paid through the banks. And as of today, we have contracted 6 banks. That is Kenya Commercial Bank, Cooperative Bank, Equity Bank, Post Bank, then we have got National Bank and Kenya Women Finance Trust. The beneficiaries, they collect money at the branches and also at the agents, which are spread all over the country. In some special circumstances, the beneficiaries can also collect the money using the ATMs, whereby they have been given the PIN. And also, all those beneficiaries have got bank accounts. Therefore, in the case they feel that they don't want to go to collect the money from the bank, they can also enable their accounts to be mobile enabled, whereby they can be able to access the money using the bank's account. In terms of the identification, we use a two-factor authentication. We use the ID and then we use the biometrics. And this way, it enables us now to ensure that there is no fraud, because it's only the person whose bios can be recognized can be able to collect the money. But when it comes now to the collection of the money, the program, the government pays for the withdrawals. There are like two free withdrawals and two bank statement inquiries, meaning that the beneficiaries, they don't incur any cost when it comes to the withdrawal of the money. And that way we are able now to safeguard, and also we ensure that if beneficiaries are deceased, their money cannot be accessed by anybody else. So we safeguard the government money.
All right, clearly loopholes all sealed.
Yes.
All right, now, before we get to the UCB, Peter, talk to us about Ksep.
Thank you so much, and I appreciate to have come to KBC for the first time. And I'm just building on what my brother has just said. Inua Jamii is a brand and is purely financed by the government. And of course, the government pays for everything. However, innovations come. And in 2017, when we were rolling out the National Safety Net program, we did what we call some kind of needs assessment, where we realized that there's need to have a consolidated way of approach towards the cash transfer, which is one of the arms of the social protection services. Hence, the Kenya Socio-Economic Inclusion Project was conceived at that time, meaning, yes, we are running the programs 100%, but we need then to think post that particular running. Hence, Ksep was born. And of course, it was approved by the World Bank in 27th of November 2018. And of course, it became effective in 20th March 2019, and is expected to end in 31st December 2023. The total amount of money that we are talking about is USD 250 million on one side, but we have a grant of about 66 million Great Britain pounds that comes to the kitty of Ksep. However, it's good to know what are the project objectives of Ksep. Very, very important. Ksep was conceived with the background effect of strengthening delivery systems for enhanced services to the vulnerable community in Kenya. And basically, Ksep is divided into three components. Number one is about strengthening social delivery systems, whereby we talk about the enhanced single registry, among others. The second aspect is the increased access to socio-economic inclusion programs. This includes the economic inclusion program. It includes also the niche program, and of course, the NHIF for that matter. And finally, the third component under Ksep is about improving the shock responsiveness social protection. We realize that, of course, COVID has taught us a lesson, but as a country, how prepared are we? When disaster strikes, how prepared are we? No wonder then the project was conceived on those lines, so that it can be able then to respond to shocks when they come. In a nutshell, that is what Ksep is all about.
And and all this is geared towards assisting the vulnerable.
Absolutely. Absolutely.
Okay, well said. Now let's come to the Universal Children Benefit Program. This is a pilot program. It's going to be undertaken in 1 year. So far, 6 months are down, supposed to end in December. But talk to us about this program and what really informed the coming up of this program, its aim and its purpose.
Maybe before my brother jumps in, a small background for us to basically understand why did we come up to this. Ideally, we realize that about 87% of most of our population are basically living in poor conditions. We can say they're earning less than 243 shillings in a day. So looking at that particular situation, we came to think about, do we still want to continue this way, and for how long? We have programs running. Inua Jamii is a brand, good program running.
And a big brand at that.
However then, we need to think, how then can we put our population in such a way that they can be better off? No wonder then we, as a government, together with the development partners, we thought about piloting a new program that is universal for children. And the reason behind this pilot is just to test to see, can universal work better than targeted programs like the brand Inua Jamii? Because under the brand, all beneficiaries are targeted to the program. But universal child benefit runs across the sub-county or location for that matter. And basically, it takes everybody at that particular parameters that you have set. For this time, we have set a parameter of between 0 and 3 years. That is 1,000 days. We have reasons towards that. And some of the reasons include, nutrition, stunting, and the rest. Therefore, it was just a small historical background so that my brother can also add. Ideally, because it's a pilot, and we don't want to say that we have a lot of money. We want to test and see how can we then effectively roll out to the entire country after we have done a study on how it works. We have 3, of course, the papers have been running this for the last 1 week. We are piloting in 3 counties of Kajiado, Embu, and Kisumu, and very specific locations. Kajiado has 2 locations, Embu has 4 locations, and Kisumu has 2 locations. Okay,
well said, Peter. Now, I just want you, John, to build up on that, even as Peter mentioned that she has been building up on that. And yes, he's talked about those of ages 0 to 3, of course, that is 36 months and under. Talked about the 3 counties that you chose, that is Kajiado, Kisumu, and Embu. And so as you build up on that, I would like for you to explain to us, particularly in specificity, why the 36 months and under? Because I would argue, when these children get at age 4, 5, 6, they haven't stopped being vulnerable in one way or the other. And then these 3 counties, why couldn't you have chose counties like maybe Turkana or something? So what really informed the 36 and under, and what informed the 3 specific counties that you're currently doing the pilot?
The reason why we choose these 3 counties is because, number one, they are not part of the Ksep counties. We wanted now to move out of the Ksep counties. So Turkana and Marsabit and others, they are part of the Ksep counties. All right. And then number 2, we also wanted to go to those counties which are arid and semi-arid. And that's where we have got high poverty levels, and also the levels of malnutrition are also very high. But the very reason why we are targeting the children who are between 0 and 36 years, it's because this is where the cognitive development of the child starts, the development of the brain. And we feel that if you get it wrong at the beginning, those children will not develop. Their brains are not going to develop. And if their brains are not going to develop, even in the future, they are not going to be very, very bright in school and doing other things. So the aim of the program is, number 1, is to ensure that there's reduced malnutrition at the household level, whereby those children now, they eat well using the money they are given as a top-up. Number 2, we also ensure that those children, they are taken for immunization. And they complete the whole immunization set, meaning that now they are going to be fully developed. And then number 3, we ensure that they also go through the growth monitoring. So they are taken to the hospital, they are checked, and all those other things here. And then finally, we ensure that the young mothers, they give birth in the recognized health facilities. Once now they do this during now the 1 year when we were doing the piloting, the mothers are normally trained on positive parenting They are taught on positive on nutrition counseling and financial literacy. So that now they are able now to know how maybe they are able now to bring up these children. And then the top of money they are given is supposed now to ensure that these children now they get a good diet. Once they get a good diet, like they get milk, and then they also mothers are also encouraged to do exclusive breastfeeding for the first 6 months or so. So that way now the child they start now developing very well, and that way now we ensure that now these children now they have taken off at the good place, considering that they come from this very poor and vulnerable communities. So that was the reason why we targeted those children, and we are hoping that in the future, even now this pilot succeeds, and then we do an impact evaluation, and we find that it has got good lessons, then now we are going out to expand maybe to more other arid and semi-arid counties, and then maybe finally in the future the program might go universal. And the reason why we are saying is that for the program for the older persons cash transfer, it is universal. It is covering everybody who is 70 years and above.
Across the country.
Across the country, yes. So our aim also this one is that once now we do this pilot in the 3 counties, it succeeds. Maybe going forward in the future, the program can also be expanded now to be universal. It will cover the whole country, and every time it will be targeting those children who are between 0 and 3 years. And the good beauty of it is that if you target the children who are between 0 and 3 years, after the 1 year is over, those who are 3 years will be 4 years. And then other children who have been born. So now you target now the newborns. And then the ones now who are 4 years, you continue with them. So that maybe in the next maybe 15 years, the program can have targeted all those children who are between 0 and 18 years. So the program is going to expand progressively.
Right.
But that will depend on the resource envelope. Yeah.
Okay, so there's actually a plan to sort of even extend the years, because that was about to be my next question. So what happens to these children once they are removed from the program after they are past 36 months? But as you say, there's a plan to sort of expand that. Again, all this based on the resources that will be available.
Sure.
Okay, makes sense. Peter, you have largely focused on health, education, and nutrition. And one may ask, this could be the pertinent issues that perhaps you spotted, but then why? Because again, there are various other issues to focus on, particularly when you look at those areas that you're targeting, could be perhaps issues to do with shelter, clothing. So why significantly, these 3 issues, health, education, and nutrition?
Thank you so much. And just to complement what my brothers just said, and I want to put it into perspective that data is the one that we rely on, absolutely. And the data that we took from the Kenya National Bureau of Statistics tells us that the counties that we chose are the ones that have got larger numbers of children below the age of 3.
Okay.
And very specific locations have more children than the other locations. So we depend on data for programming of any particular program that we want to run off. And secondly, why then did we look at those 3 aspects, health, nutrition, and socio-economic? Ideally, the basket that any particular person has can only be divided into basically 3: food, and of course education and shelter. Now, if you look at the statistics again, they'll tell you the population that are poor. And in any amount of disposable money you have, where will you spend it more? Ideally, you spend it more in education, health, and of course shelter. However, we have programs that are running. There's free primary education, there's school feeding program, and we looked at all those aspects. We are alive to those facts. But even though the locations that we chose still have those, but the statistics don't lie. They still tell us, yes, there's still a challenge here. Can you then do an intervention that in the long run can give us some positive impact that can then sell our idea to not only ourselves, but the entire Kenyan, so that they can be able to then say, all right, this program can run the time. And that is the reason why we, as a State Department, we say, all right, we are trying this, and then we study the impact. If the impact is positive, then we'll roll it out, although of course in progression to the entire country within the next, maybe before 2030.
All right, makes sense. Now, John, you are disbursing 800 on a monthly basis, is it?
Yes.
800 shillings. Now, it is a good initiative, and we really laud the state, because also, as you mentioned, with the various programs, in fact, there's a specific one that actually the state does it just without, on its own, without necessarily relying from donors and grants, which is a good initiative. I mean, at the end of the day, trying to assist the vulnerable, the orphans, the old, and even right now, the younger children. But with the high cost of living, just in the morning you're asking, what can 100 shillings buy you? So this 800 shillings, how did you arrive at this figure? Again, like I said, knowing fully well that right now the cost of living in our country is really high.
Okay, let me put the record straight.
Okay.
For the UCB, the program is a pilot program, and it is supported by development partners. The money comes from UNICEF and World Food Program. Right. Because UCB is not part of the Inua Jamii cash transfer. So the 800, I think they did some analysis, and they found that this money is a top-up of the already 2,000 shillings which they are getting. Okay. So all the beneficiaries of the UCB, they are also beneficiaries of the Inua Jamii cash transfer programs, so those households.
So this is like an addition?
It's an addition, absolutely. Yeah. It's actually a top-up. Okay. And the idea of the 8,000, I think, was also dictated by the amount of money which was budgeted now for the pilot for the 1 year. But maybe moving forward, depending on the resource envelope which might be gotten, maybe the money can be put higher. It's also important to note that when this program was started, the current inflation was not envisaged. So there's something which has just come. The cost of the milk, the cost of food, and all those things has gone up. Yes. The other thing is that the reason why we normally do the pilot is because we are also able to gauge the impact of that money they are getting, whether it is impacting positively or negatively. And based on the lessons now, it informs now future programming and progressions. Yeah. So for the planning now, which we are now going to do in the future, it will now be based on the outcome of the impact for the 800. But the 800 is actually up and above the 2,000 which we give. So if we say that we are giving after every 2 months, it will mean that we are giving 1,600 per household, on top of the 4,000 which they are getting. That will amount to be 5,600 per household.
That is in every 2 months?
Yeah.
All right, well said. Let's talk about the mode of payment, because even as it stands, we know that with the various programs, particularly for the older persons, when you speak to a number of them, they will tell you that I received this 2,000 this month, next month sikupata. Next month ingine nimepata. Then again after 2 months sijapata. So how are you tracking how these households that you've identified are receiving this money, and which mode of payment are you using? Because it has to be impactful at the end of the day.
Thank you. I'll want to, in two pieces.
Okay.
I'll respond to the UCB, and my brother will respond to the brand.
All right.
Allow us to call it the brand because that is our brand.
Okay.
Under UCB, all our money is transferred via Safaricom. So the issue of I didn't get or what does not arise, because statements are always presented to us, and we are able to say, you got it on this date, this time, this was your number, and the name that came was this. So the issue of them trying to refuse does not arise at the moment, at the pilot stage. We wouldn't know, and we wouldn't want to preempt any discussion past the pilot stage, because once the program is big, there are so many technicalities in programs, and sometimes it becomes very difficult to understand certain logistics within the program. However, under the Inua Jamii brand, my brother will want to respond briefly of why do we get, why do we don't get. It might be a myth, it might be a theory. Maybe my brother would want to respond on that. Thank you.
But ideally you're saying that even with this pilot phase, whatever amount is being given to these vulnerable persons, the children and their caregivers, that you are sure it actually gets to the various households.
Absolutely.
At the end of the day.
That is for sure.
All right, I can see, John agreeing fully on that indeed.
I do agree. I entirely agree. Then for the Inua Jamii cash transfer, I would say that this year has been unique. because in the original design of the program, the payments are meant to be timely and predictable. Timely and predictable. But this year, we have not been timely, we have not been predictable. And the reasons...
So that's a shortfall on your side?
Yeah, on our system-wise.
Okay.
The reason why is that we had a contract for paying of the beneficiaries which expired last financial year. That time we were using the 4 banks. And then from July, we know our financial year starts in July. From July this financial year, we did not have a contract for paying of the beneficiaries. So we started the process on now the tendering for the new contract. And the contract was signed in 18th of October 2021. And as a result, therefore, the money for the payment of the beneficiaries was delayed. As a result, therefore, we were able now to pay the months for July, August, September, October. We paid it in lump sum. That was 8,000, and we were able to pay that money in December last year. And then, because after now that transition now from the old contract to the new contract with these new banks, beneficiaries have to open bank accounts. They also had to change maybe from the old account maybe to you are in Equity, maybe you want to go to KCB. To KCB you also had to transit. So that was also taking long.
So there's a bit of technicality here and there.
And then now for the payment for now November, December, January, February, we were also able to pay that money in the month of October. As we are talking now, we have already prepared the payroll. We finished it last week for the money for the March, April, May, June. And we will be able to pay by end of this week or early next month, we will pay now another 8,000. Meaning that for the whole of this financial year, once we pay that last batch, we'll have paid the 24,000 for all the beneficiaries. So even if the money is delayed, we ensure that by the time we are closing the financial year, they get all the year entitlement.
Well said. At least now you've dispelled the myths and misconception. And I'll give you the last word, Peter. As stakeholders, 6 months down in this pilot phase, it's going to be complete by December. That's like around the next 5 or 6 months. What are you envisioning, or what will be your recommendations even so far?
Thank you. I want to believe that programs come to give a new dimension in life. And all the programs that we've started, we've never failed. Even though failure is part of our life, but we've never failed. I want to envisage that in the next 6 months, as we close the program, we'll then transit to even a bigger program. That notwithstanding, and I want to believe this, that the government has done its best. It has absolutely done its best, and we are happy working for the government that it has done its best. However, then, we hope that, and this question should be asked to our good friends who are coming in, and to be in 2 directions. Number one, there will be the demand side, that is the amount of money that's available for social protection intervention programs, and of course, looking at the supply side, which is the number of people who are vulnerable and in need of social protection interventions. And this, you might want to ask them as colleagues when you're having your debates. What are the plans in place for the social protection fraternity, so that we are able to basically understand that, yes, this is the direction we are taking. But ideally, in Kenya, the best way to go is social protection, so that it can cushion the vulnerable against shocks, and of course put more money in the hands of the vulnerable people.
All right, well said. And a good place to end it. Asante sana for coming, gentlemen.
Thank you.
Thank you.
Okay. I've been speaking to John Gachagi, to my immediate right, who is the director, Directorate of Social Assistance. Right next to him is Peter Ombasa, Assistant Director, Children's Services. Of course, talking to us about the Universal Children Benefit Program and what the state is doing in assisting the most vulnerable children in our society. Good place to end this conversation, and ultimately, good morning, Kenya. I'm Doreen Arange Okello. On behalf of the entire team, asante sana. Do this again tomorrow. Have a good Monday morning.